Hi there, it's Dr. Linda Burke. I am a board certified OB-GYN physician, and unfortunately I have some very sad news to report. You know, this is my passion, this is my jam, and unfortunately I have to report that another woman who looked like me died 8 days after having her baby. Her name was Ellen James Robinson. I'm going to play a little bit of the statement that was made by her family, but once again, here we are in the 21st century.
This week, we had a tragedy in our family. My husband, Mike's younger cousin, passed away right after childbirth. Baby was not even a few weeks old. She's a newlywed, had her whole life ahead of her, and it's really devastated folks over here because we are still struggling to understand, especially considering it could have been prevented. You know, she'd been back to the hospital multiple times saying she was in pain. She just didn't feel right since she'd had the baby. But no one listened.
Now, her family reports that she had been going back and forth to the hospital on several occasions, complaining of pain and discomfort, and was sent home.
Just doctors not paying attention to the signs, not listening, not thinking that we know our own body. And by the time she'd gone back the last time, she had a septic infection that took her life.
And finally, a light bulb obviously went off in someone's head and realized that this woman now has sepsis. Sepsis is something that doesn't start overnight. Sepsis basically means you have a very, very bad infection that's affecting multi-organs in your body. But it takes time for this to develop. And so that means that whoever was sending her home was misdiagnosing her. So can I tell you, new school, may I make some suggestions to the new school OB-GYN physicians, because I'm old school. And when I practiced and when I trained, we were allowed to set policy. We could keep a patient who had a normal vaginal delivery in the hospital up to 3 days in case there was a problem. And usually most women go home at 3 days went home without, in 3 days without a problem. But sometimes, like on postpartum day 2, you would start to see issues. You would start to see an elevated white count. Something would be emerging, and you had the time to address it, to treat it, and you sent her home and she didn't come back a couple of days later. Fast forward to 2022, that is not happening. So when someone comes into the hospital who had a baby within a postpartum period, can I ask y'all to do a couple of things if you don't mind? Can you check her white count to see if it's elevated, if she has an infection? Because I can guarantee you that Mrs. Robinson did. Can you put your hands on her abdomen to see if it is tender, if you elicit rebound? That is like basic 101. And let's be real, a lot of y'all don't even put your hands on the patients before you send them home. Can you, if she is complaining about pain, can you get some sort of imaging study to determine the reason for the pain? There's always, and this is so basic in terms of medical school training and residency training, pain is a symptom of a bigger problem. I respectfully plead with people who have recently had a baby. If you go into the hospital, demand to see an OB-GYN physician or clinician. Because all due respect to ER doctors, their training is very different. Do not leave the emergency room until someone from the OB department has seen you. And last but not least, when you walk into that hospital, get the names of everyone who saw you, starting from the clerk and the nurse and the physicians and even the discharge clerk who hands you your papers and sends you home. You know why? Because God forbid, if something happens to you, all those people who were involved in the care that led to your unfortunate demise are co-defendants. My profound sorrow and condolences to the Robinson family. And because of the circumstances with her going back and forth until she had an infection that was so bad, it basically killed her, lawyer up. Thank you for listening, and I'll see you next time.